Hello everyone. This presentation is on Ling Tang, also called polyporous decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Ling Tang belongs to the category drain dampness. A representative pattern is damp heat in the lower burner with urinary difficulty, thirst, and irritability. Important ingredients include Ling, Ling, Zizai, Huashi, Egio. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 63-year-old woman with recurrent urinary discomfort after medical evaluation. The current medicines are furosemide, apixaban, levothyroxine. This case gives a possible reason to consider Ling Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is formula diuresis plus furosemide. The mechanism is that combined diuretic effects can worsen dehydration or electrolyte imbalance. The clinical significance is moderate to high in older adults. My management plan is monitor weight, hydration, renal function, and electrolytes. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Egio plus apixaban. The mechanism is that, although evidence is limited, any formula used in a bleeding risk patient deserves caution when abnormal bleeding is possible. The clinical significance is uncertain, but clinically relevant, because apixaban already carries bleeding risk. My management plan is watch for bruising or bleeding and coordinate with the prescribing clinician. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Huashi plus levothyroxine. The mechanism is that mineral-containing substances may reduce levothyroxine absorption. The clinical significance is potentially relevant. My management plan is separate levothyroxine from the formula by several hours. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Ling Tang may be reasonable when the patient truly matches the pattern damp heat in the lower burner with urinary difficulty, thirst, and irritability. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.